Imagine this. You wake up in the dead of night. You feel a crushing weight on your chest, making it impossible to breathe. You try to scream, but no sound escapes your lips. You're trapped, paralyzed, as if an invisible force has you in its grip. This terrifying experience is known as sleep paralysis, a sleep disorder that affects millions worldwide. While it's generally harmless, sleep paralysis can be an intensely frightening experience, often accompanied by hallucinations and a sense of impending doom. Sleep paralysis occurs during the transition between sleep stages, either as you're falling asleep or waking up. During these transitions, your mind regains consciousness before your body, leaving you aware of your surroundings but unable to move or speak. This disconnect between mind and body can trigger feelings of fear and anxiety, leading to a vicious cycle that exacerbates the paralysis. The experience can last anywhere from a few seconds to several minutes, leaving you feeling shaken and exhausted long after it's over. Though terrifying, it's important to remember that sleep paralysis is not life-threatening. It's your brain's way of protecting you during REM sleep, the stage where vivid dreams occur. Understanding the science behind this phenomenon can help alleviate some of the fear surrounding it, empowering you to regain control of your nights and achieve restful sleep. Sleep paralysis is a common sleep disorder, affecting an estimated 7.6% of the general population. It can occur at any age, but is most prevalent during adolescence and young adulthood. While the exact causes of sleep paralysis are not fully understood, several factors can increase your risk, including sleep deprivation, irregular sleep patterns, and underlying sleep disorders such as narcolepsy and insomnia. Stress, anxiety, and trauma can also contribute to sleep paralysis, as these factors disrupt the normal sleep cycle and increase the likelihood of fragmented sleep. Certain medications, such as those used to treat ADHD and depression, have also been linked to an increased risk of sleep paralysis. The effects of sleep paralysis can extend far beyond the episode itself. Many individuals experience persistent fear and anxiety about going back to sleep, leading to insomnia and daytime fatigue. This fear can significantly impact their quality of life, affecting their work, relationships, and overall well-being. Understanding the underlying causes of your sleep paralysis is crucial for developing effective coping mechanisms and prevention strategies. Sleep paralysis has been the subject of countless myths and legends throughout history, often attributed to supernatural beings or paranormal activity. One common myth is that sleep paralysis is caused by a malevolent spirit sitting on one's chest, suffocating them. This belief stems from the sensation of pressure on the chest that often accompanies sleep paralysis, which is actually caused by the paralysis of the respiratory muscles. Another myth is that sleep paralysis is a sign of impending death. While the experience can be terrifying, it's important to remember that sleep paralysis is not life-threatening and does not predict future health problems. Some cultures believe that sleep paralysis is a form of astral projection or out-of-body experience, where the soul leaves the body and travels to other dimensions. However, there's no scientific evidence to support these claims. Sleep paralysis is a physiological phenomenon, not a mystical or paranormal event. Recognizing the difference between fact and fiction is crucial for overcoming fear and managing the condition effectively. While sleep paralysis can be a frightening and disruptive experience, there are several things you can do to reduce your risk of experiencing it and manage its impact on your life. One of the most effective ways to prevent sleep paralysis is to establish a regular sleep schedule and ensure you're getting enough sleep. Aim for 7 to 9 hours of quality sleep each night, and try to go to bed and wake up around the same time every day, even on weekends. Creating a relaxing bedtime routine can also help signal to your body that it's time to sleep. Take a warm bath, read a book, or listen to calming music to quiet your mind and prepare for sleep. Avoid caffeine and alcohol before bed, as these substances can interfere with your sleep cycle and increase the likelihood of sleep paralysis. If you do experience sleep paralysis, there are several things you can do to try to break out of it. Try to focus on small movements, such as wiggling your fingers or toes, or try to cough or clear your throat. These movements can help break the paralysis and restore your body's mobility. Section 5. When to seek help. You are not alone. While occasional episodes of sleep paralysis are generally harmless, Frequent or severe episodes can be a sign of an underlying sleep disorder or other medical condition. If you experience sleep paralysis regularly, or if it's affecting your quality of life, it's important to consult a healthcare professional or sleep specialist. They can help determine the underlying cause of your sleep paralysis and recommend appropriate treatment options. Treatment for sleep paralysis may involve addressing underlying sleep disorders such as insomnia or narcolepsy, managing stress and anxiety through therapy or relaxation techniques, or adjusting medication if it's a contributing factor. Remember, you're not alone in this. Sleep paralysis is a common sleep disorder, and there's no shame in seeking help. Reaching out to a healthcare professional can provide you with the support, guidance, and treatment you need to overcome sleep paralysis and reclaim restful nights. Section 6. Understanding the role of stress and lifestyle. Our modern lifestyles, often characterized by long working hours, constant connectivity, and sleep deprivation, can take a toll on our sleep health. Stress, in particular, plays a significant role in triggering sleep paralysis. When we're stressed, our bodies release hormones like cortisol, which can disrupt our sleep-wake cycle and increase the likelihood of experiencing sleep paralysis. Managing stress through relaxation techniques such as meditation, deep breathing exercises, or yoga can be beneficial in reducing sleep paralysis episodes. Lifestyle factors such as diet and exercise also influence our sleep quality and contribute to sleep paralysis. Consuming a balanced diet, avoiding heavy meals before bed, and engaging in regular physical activity can promote better sleep and reduce the risk of experiencing this sleep disorder. Creating a conducive sleep environment is equally important. Ensuring a dark, quiet, and cool bedroom can improve sleep quality and minimize sleep disturbances, including sleep paralysis. As Section 7, the power of sleep hygiene. Restoring your natural rhythm. Maintaining good sleep hygiene is crucial for preventing and managing sleep paralysis. This involves establishing regular sleep patterns, creating a relaxing bedtime routine, and optimizing your sleep environment. Try to go to bed and wake up around the same time each day, even on weekends, to regulate your body's natural sleep-wake cycle. Avoid consuming caffeine or alcohol before bed, as these substances can interfere with your sleep and increase the likelihood of experiencing sleep paralysis. Make sure your bedroom is dark, quiet, and cool, and invest in a comfortable bed and pillows. Avoid watching television or using electronic devices before bed, as the blue light emitted from these devices can suppress melatonin production, a hormone that regulates sleep. By prioritizing sleep hygiene, you can create an optimal environment for restful sleep and minimize the chances of experiencing sleep paralysis. Section 8. Personal stories. Triumph over terror. Sleep paralysis can be an isolating experience, but hearing personal stories from others who have overcome it can provide comfort and hope. Many individuals have shared their experiences with sleep paralysis, describing the fear, confusion, and helplessness they felt during these episodes. However, they also highlight the importance of understanding the condition, seeking professional help, and implementing lifestyle changes to manage it effectively. One woman shared her experience of waking up paralyzed in the middle of the night, feeling a presence in the room and hearing whispering voices. She described the terror she felt but also emphasized the relief she experienced after learning about sleep paralysis and realizing it wasn't a supernatural phenomenon. Through therapy and lifestyle changes, she was able to reduce the frequency and intensity of her episodes, regaining control over her sleep and her life. These personal stories serve as a reminder that sleep paralysis is a common sleep disorder that can be managed with the right knowledge and support. Section 9. Expert opinions, insights from sleep professionals. Sleep experts and researchers have made significant strides in understanding sleep paralysis, its causes, and effective treatment strategies. They emphasize the importance of addressing underlying sleep disorders, managing stress, and practicing good sleep hygiene to prevent and manage sleep paralysis. Dr. Michael Bruce, a clinical psychologist and sleep expert, recommends maintaining a consistent sleep schedule, creating a relaxing bedtime routine, and avoiding caffeine and alcohol before bed. He also suggests trying to stay calm if you experience sleep paralysis, reminding yourself that it's temporary and not life-threatening. Dr. Rafael Palayo, a sleep specialist at the Stanford Sleep Medicine Center, highlights the role of stress and anxiety in triggering sleep paralysis. He recommends relaxation techniques such as deep breathing exercises, meditation, and yoga to manage stress and reduce the likelihood of experiencing sleep paralysis. These expert opinions provide valuable insights into the nature of sleep paralysis, its causes, and effective management strategies. Section 10. A final word: reclaiming your nights. Sleep paralysis, while terrifying, is a common sleep disorder that can be effectively managed with the right knowledge and support. By understanding the science behind it, debunking the myths surrounding it, and implementing practical tips for prevention and management, you can reclaim your nights and achieve restful sleep. Remember to prioritize sleep hygiene, manage stress, and seek professional help if needed. You are not alone in this journey. Millions of people worldwide experience sleep paralysis, and there's no shame in seeking help. With the right support and guidance, you can overcome sleep paralysis and enjoy the restorative power of sleep. Sweet dreams.